People communicate with their eyes, and the eyes are the first facial feature that people observe. Unfortunately, they are also one of the first to show signs of aging. Changes of the eyes with aging is seen as a tired look. It's for this reason that eyelid surgery is the most important cosmetic procedure on the face for most people. Improvements to the eyelids have a magnified effect because of the difference eyelids make to the overall look of the face. People with bright eyes always look lively and alert, giving a youthful, attractive appearance. As we know, aging is relentless, and the changes that eyelid aging brings to the face are heavy, baggy and hooded eyes, portraying a tired look. In fact, if you were contemplating having only one part of the face corrected, then upper eyelid surgery is that procedure. 25 years ago, I learnt the supratarsal fixation procedure, which I've continued to use and refine. It is a precise procedure which emphasizes the contours and curves above the eye and removes the heaviness, hooding and drooping without depending on skin tightness. Men especially benefit from this procedure because a man's face is particularly suited to a controlled and slightly underdone result, which can be achieved with this technique. Understanding the reason behind laxity and how to reverse it has been a wonderful advance in eyelid surgery. For over 20 years I've used and progressively refined the tarsal fixation technique because it provides control and predictability. Although we speak of the lid as a single structure, the lid is formed of two distinct segments that are separated by a crease. These are the pretarsal part below and the infrabrow part above, separated by the lid crease. Although the two segments are separate, they are interrelated. The balance between the two interrelated segments is controlled by the all-important lid crease. Achieving control through the lid crease is the basis for the tarsal fixation technique. The pretarsal segment is fixed and it should be smooth, whereas the infrabrow segment is not fixed and varies with lid movement, as in blinking and expression. The infrabrow segment bulges or hangs over the crease according to age. The lid crease influences the appearance of the lid, even though the crease itself isn't usually visible. The appearance of the lid is determined by the amount of pretarsal skin on show, which in turn is influenced by the infrabrow segment, its amount and its quality. Both of these are controlled by the lid crease. With aging, the fold hangs progressively lower, becoming more like a curtain, and it conceals more of the lower lid skin below the crease. With further aging descent, the curtain of skin ends up close to the lashes and it changes shape so that the lid fold hangs diagonally across the outer corner of the lid skin. It's important to understand that the problem is not truly excess skin as people suppose, even though the skin may appear to be excess. What has actually occurred is a detachment of the skin from its correct position deep within the eyelid, where it used to appear as a neat crease above your eye. As the skin releases from its attachment within that fold, it becomes lax, and this means that the neat, clean contour above your eye is obscured by the drooping skin. Tarsal fixation surgery operates internally on the support layer, beneath the skin, and not directly on the skin itself, and this is the key to a natural and lasting result. The extremely fine incision is set precisely in the crease of the eyelid, which heals so perfectly it is undetectable within months. Restoring the correct location of the true lid skin by first defining the crease allows for a shorter incision, another great advantage because it doesn't need to be extended onto the visible areas at each end of the lid crease. Tarsal fixation surgery corrects directly at the side of the aging, restoring an attractive contour above the eye so the shape is again revealed and the eyes look bright and full of life. This woman complains of the tired look on her face, and this is largely attributable to the aging of the upper lid. You can see, particularly in the temporal part of the lid, the hooding from the infrabrow segment is hanging over the lid proper, that is the pretarsal segment, so she needs a proper contouring of the upper lid. After surgery, she has a bright look to her eyes, not so much from resection of skin, but mainly because the contour of the lid has been recreated by the tarsal fixation. As with all the techniques I use, there is absolutely no skin tightening because that is the opposite of quality surgery. Traditional surgery uses a type of nip and tuck of the skin between the lashes and brow, which tends to result in visible scarring and an unnatural appearance, whereas the tarsal fixation technique leaves the patient with no visible scarring, resulting in a natural and lasting result. Let me explain why. The tarsal fixation method corrects skin laxity primarily by redefining the lid crease and not by the removal of a large amount of skin. This patient has an overall heaviness of her upper lids, partly due to descent of the brow, but also the obscuring of the natural contouring of the upper lids. The result shows a brightening of her eyes as a result of the tarsal fixation, which has achieved a controlled but underdone correction, because it doesn't need to be overcorrected to be lasting. This procedure is remarkable for its long-term benefits. In fact, most patients do not have their eyes redone, and many of my patients have better looking eyes at 60 than they did at 40. For some, this will be all they ever need. This patient looks younger 14 years after her eyelid surgery. As you can see, the results are remarkable, showing naturally bright eyes without any evidence of a surgical look. I hope this video has given you a better understanding of aging of the eyelids. Of course, if you need specific personal information, I would encourage you to come and see me or my patient advisors for a complimentary consultation.